The following program is sponsored by the Medicine Center Pharmacies.
And welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank Mercy Medical Center, Studio Arts and Glass, and of course our technical producer today is John Bozica. In the studio with me is Nancy Warmby, Executive Vice President of Medicine Center Pharmacy, and our very special guests, Bobbi Freeman, Cancer Nurse Navigator, and Jaymi Doerfler, GYN Cancer Nurse Navigator. Good morning, ladies, and welcome to the show.
Thank you. Good morning. Thank you.
If you have ever been told you have cancer, you probably remember that dreadful feeling, as though the bottom just dropped out of your life. Once you heard the word cancer, whatever the doctor said from that point on was background noise. You had to process this frightening moment. The family member or friend who you may have brought with you was probably equally stunned. First the shock, then the questions about the disease and managing your life as a cancer patient. So that you don't feel alone during this scary period of your life, Mercy offers nurse navigators. Friendly, familiar professionals who guide you through all the worries, concerns, and questions that you might have. This morning we have 2 nurse navigators with us to talk cancer risks, screening, and prevention. We'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions you'd like addressed during the program today, please post them on our live Facebook feed.
So, Bobbi and compadre today, introduce yourselves and tell us what you do, I guess.
So I'm Bobbi Freeman, and I have been a nurse navigator in the Cancer Center for actually 14 years now.
Okay.
And I'm Jaymi Doerfler, and I'm also a cancer nurse navigator. I've been in cancer or oncology now for 14 years. So
Now, how did both of you end up in this end of the healthcare?
Well, I made a very odd switch. My first 5 years was labor and delivery at Mercy,
Okay.
But always had an oncology interest, was just ready for something new. So I went to the Cancer Center. I did clinical trials the first year, and then just moved into the navigator position.
Okay.
Yeah.
Now, we were talking about this in the outside the studio, this about clinical trials and stuff like that. Is that part of it? And I missed your introduction, so
that's okay.
We'll catch up with you.
That's fine.
You started out birthing and that sort of thing. Was there any cancer investigational process that was going on during that process, or during the first of the month, of the 9 month, the whatever?
Like clinical trials with pregnant ladies?
Yeah.
No, I didn't do any. No, that's not really an arena we do anything because clinical trials, we're talking, is very specific to oncology, and those are two worlds we would never, even regular chemotherapy outside of a clinical trial is very touchy, very sensitive when the lady's pregnant, because then you're dealing with a baby too.
Sure, of course.
Yeah, so that's not even anything that Mercy would really touch on.
And tell us about yourself, Jaymi.
So like I said, I've been in oncology now for about 14, 15 years. I've been a nurse for 17, and I kind of just stumbled on oncology. Wasn't quite sure what I wanted to do, but once I got into oncology, I think once you become an oncology nurse, you don't leave.
I see. Very interesting. Okay. It is spring, and we're hoping for a sunny weekend, hopefully. What should listeners consider if they're planning to get a tan? We're jumping in a different way.
Yeah, well, so my answer is probably not going to be favorable to most people, because what we know is that tan skin is just unhealthy skin.
Yeah, for sure.
Yeah, and some facts with that is because skin cancer is actually our most common type of cancer in the United States, and more skin cancers are actually diagnosed than all of your other cancers put together. So that's a really high number. So we know that most skin cancers are a direct result of that exposure to the UV rays from the sunshine. So obviously protecting ourselves from that is absolutely important.
It appears that we don't have a tanning salon on every corner like we used to have, years ago. But I'm guessing that it's still going on big time.
It is, absolutely, yeah. I think, yeah, you're right. I think that's lessened, but yes, still lots of, and I mean, in tanning beds, but just out in getting as much sun. I think come summer here, we wait for summer, that once it gets here, it's like, oh, let's get out there and in the sun and enjoy every minute of it. And yeah.
Especially in Ohio.
Yes,
we got to get tanned to get into the sun to get tanned, or to keep the tan. Is that right?
Exactly.
Okay.
Well, there's a shortage. So many people are deficient in vitamin D. Yeah. So how do you reconcile that? Making sure you get enough sunshine to get appropriate vitamin D, but then also not so much that you're hurting your skin.
Right. And they definitely, are saying at this point that vitamin D supplements are definitely the better way to go, because again, we have that skin cancer. You just have such a high risk with the sun. We know that. That's a known thing. Where the vitamin D supplements are a very well complement. And another thing too, they said with the vitamin D is, you can regulate if you're taking it in pill form. We know that we're getting some from the sun, but you don't know how long or how much, or how long do you have to be in the sun to get so much vitamin D. So at this point, American Cancer Society definitely still says that the vitamin D benefit from the sun is not enough.
So what tips are you going to offer us to keep us safe when we're out in the sun this weekend? Because we're not staying in.
Right. And, yes, we're not going to avoid
stay in if it rains.
Right. Well, if you're going to be outside, absolutely staying in the shade, if possible, during those midday hours. If any time you're going to be out, that 10 to 4 is really your most crucial time. When the rays are going to be strongest. And so if you can stay in the shade during those hours, that's best. But if you are out, you definitely want to protect your skin. There's clothing with SPF. Even just having things covered up, wearing a hat makes a huge difference to protect your head and your face. Wearing sunglasses, because we don't realize there's a risk to the eyes as well, and even the very sensitive skin around your eyes. So having sunglasses when you're out there is a big thing. And then, of course, sunscreen. Wearing sunscreen is a big factor in protecting your skin.
So there's a great question there. So SPF, there's everything from 2 to 100. Mm-hmm. If 45 is good, 100 must be better, right?
Well, maybe. The biggest thing you want to remember, first of all, is to use a broad spectrum, because that means there's 2 different types of rays that can be a concern. It's going to block both of those. So that's definitely the first thing you want to look at in a sunscreen. And then when it comes, American Cancer Society is still recommending 30 or higher. And the reason with that being is that, yes, the higher the number, the more protection there is, but it's very little. So 30 gives you a coverage of 97%, 50 is 98%, and 100 is 99%. So you see there's only 2% difference to go that hit. And I believe that when you go from 100, you're seeing a big old price difference for really only a 2% coverage at some places.
The 30s and 50s used to be really expensive, and they've kind of come down into reality. I don't think we have any hundreds.
How about?
Yeah, they're starting to come out.
Okay, I was going to say I haven't seen any yet in the promos or anything like that.
Yeah, so. And again, it's for 2% difference. Are we?
And there was a time when they said that anything over 30 was of no value. Now, I don't know if the chemicals they're loading in the products now are more sophisticated or what. So.
Yeah, I don't know. I mean, still only 1 or 2%, so probably not.
Yeah.
How about spray versus cream? Any difference?
There doesn't seem to be spray, cream, whatever form, whatever works for you. It's really a personal preference.
Do you have any application guidelines you want to share? How often should we reapply? What if we're, spreading our mulch and sweating to death? And
yes, and interestingly, I was just reading that they can't even label them waterproof anymore. Because that's so unregulated, and people assume because it says waterproof, I can do all these things, I can sweat all day, and it's not going to matter. So they've actually said they've had to take that off.
So
now.
Put it back on frequently.
Yes,
you're in the water.
Yes, technically it's every 2 hours, or if you are in the water, you are sweating, even more frequently. Because that's a lot of times people think, I'll just add more sunscreen, or I'll use a higher, and then I can stay out longer, or I don't have, and that's where a lot of burns and things like that happen because people aren't reapplying.
So is there any difference in children, or especially young children? So when I'm out with my grandson, boy, I'm making sure he's wearing a hat and lathering him up real well. Are the requirements any different? Should I be doing them more frequently?
No, it's still the 2 hours, but definitely making sure you're staying on top of that. Kids aren't going to remember. They're often playing, and it's the last thing they want to do. And, if they're like my kids, griping because they have to put it on.
Yeah.
But that is really important because it's really the long-term exposure. We know the more sunburns at an earlier age and over a lifetime, you increase that risk of skin cancer. It's not necessarily what I get in one day. It is, but it's really the adding up of all those days and all that sun exposure put together.
So how about, boy, it's been in the news a lot lately that sunscreen's going to seep into your bloodstream. Should we be concerned about that?
So this is definitely a topic that still needs more research. The study that most of us are hearing about was a very small, like 24 people in that study.
Oh.
So, they don't know. They don't know at this point. What we do know is that in 2018 alone, there were 300 new cases of melanoma. Oh. So we know that skin cancer is a huge issue. So at this point, American Cancer Society, FDA, American Academy of Dermatology are all still recommending we use sunscreen.
So in the sun, and when it's hot, okay, and the sun's on you, do your pores have a tendency to open more? There's been years and years of research on pushing drugs through the skin, okay, and we have many products out there now that are pushed through the skin, basically. What do you think? Do we have any research on that?
I don't know. There's no research that I've read about it.
Okay. I mean, everything expands in the heat.
Yeah.
Why wouldn't the pores open more under the heat?
Yeah. And I know this study, too, that the one study that they're kind of bringing into the news, the application was every couple hours, every day on the people in the study. And that's not reality. I mean, who is putting sunscreen on every 2 hours every single day?
They're not. They put it on, jump in a pool, and forget about it the rest of the day.
Yeah, right. And, so of course, with that large of amount, there's a better chance of it causing problems than you and I are going to put it on, a day here and there.
Okay, we're going to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Have you heard about Tap On It? It's a new way to get great coupons on your smartphone from all types of vendors. Hi, Paul White for the Medicine Center Pharmacies. So you text the words Tap On It, that's Tap On It, TAPONIT, 82928. Tap on the link that comes up, and up comes your coupons. The Medicine Center Pharmacy coupons are buy $30 worth of merchandise at the Medicine Center Pharmacy and get $10 off. You can also earn a free first aid kit. This is a great way to save money. Tap on it at the Medicine Center Pharmacy.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Wendy here from Studio Arts and Glass. I'd like to invite you to our annual Garden of the Arts show, Friday and Saturday, June 14th and 15th from 9 until 8 p.m. You'll find fabulous, vibrant colored summer jewelry, horsehair pottery, and tons of hummingbird feeders. Come for the great food and La Pizzeria's famous brownies. We're on Apple Grove and 77 in North Canton. or find us at studioartsandglass.com.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. A locally owned Health Mart pharmacy, whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we are discussing cancer care with cancer nurse navigators Bobbi Freeman and Jaymi Doerfler. Have a question posted on our live Facebook feed. So, it seems like there are frequent news featuring something new that is suspected of increasing our cancer risk. Okay, what should we be doing to everything I eat anymore? This awful, or is this going to give me cancer or whatever? And I don't drink very much. I don't smoke. Okay, so what's left out there?
So there's some basic things. If you don't smoke, obviously, you want to stay away from tobacco. Like Bobbi talked about earlier, you want to protect your skin, stay safe in the sun. You definitely want to eat healthy. So we're kind of staying away from processed food and limiting our red meats, eating plenty of fruits and vegetables. Limiting your alcohol intake is a big deal. Women should have 1 drink a day, men 2 drinks a day, all in moderation. And really
when you say drinks, beer, wine, whiskey, vodka.
Right. So the American Cancer Society recommends that 1 drink is equivalent to 12 ounces of beer or 1.5 ounces of hard liquor or 5 ounces of wine.
Gee, 1.5 ounces, that ain't very much.
I know. When you're talking of 5 ounces of wine, that's very small, but that's moderation.
Okay.
And then really, I think it's important to stay up to date with your primary care physician. So making sure that every year you at least schedule that well visit. I know we see our primary care physician when we're sick, but having that conversation at least once a year about your recommended screenings.
Well, we do twice a year. The Rotary Club twice a year does screenings with Mercy, and we just recently did one. We've had a lot of people and keep growing and growing and growing. I would bet you most of the people in that room never have never have lab work, and this is a real plus, for those people at a low price. So,
yeah, that is awesome.
So we appreciate the hospital, helping us put that thing together.
Yeah, absolutely.
So smoking remains a huge risk, obviously. It just amazes me that people are still smoking, and I'm a veteran parking lot cleaner, okay? So, and it is amazing the amount of trash those people throw in the parking lots. It's a daily venture to clean up the cigarette butts and the tobacco, and in one of our stores, the chewing tobacco, which just amazes me. Somebody chews tobacco. So, and now we're vaping. Okay, we got kids vaping. Okay, high school kids vaping, and I don't know if they're allowed to buy this stuff or if they get it contraband or what. But there's a lot of kids, I guess, vaping. So, what do we do with this? Everybody I talk to, you're still smoking. I can't believe you're still smoking. Oh, I'm addicted. Get unaddicted. Okay.
Yeah, that's what I say. Quit.
Yeah.
So I don't know what's a solution here. It brings in a lot of dollars. You take the cigarettes out of the tax mix, and there's going to be a lot of money not available to spend on whatever.
And unfortunately, that's where the vaping is really focusing on that youth. That's their big goal with their agenda. Is they're putting it down low. They're making them all pretty and fancy, and things that kids taste. Yes, but what we know, so e-cigarettes, they're better than cigarettes. But the long-term effects, and that's for someone that's smoking. Obviously, they'll use it as a step to go from smoking to the e-cigarettes. But we don't know those long-term effects on the e-cigarettes. They haven't been around long enough to really know. But we do know they have nicotine in them, just like regular cigarettes.
Well, we're on a trail here, too, of approving. There's 10 states now that approve marijuana. And we're on the trail here, I think, of every state in the country going to approve marijuana. So it's like a tobacco of sorts. I mean, it's irritating to the lungs and, all that sort of thing. It's going to make things worse.
That one, there's still a lot of research. There's a lot of debate. We're kind of a different world when it comes to that with oncology, because we can see great benefit with our patients when it comes to marijuana. For pain, for symptom control, it's sort of a different population than, just recreational use.
Yeah.
So definitely kind of a whole topic in itself.
Right.
But in the oncology world, I don't necessarily think that's going to be a bad thing for medical marijuana.
You still, to make it work, you inhale it.
Yeah, again, though, in oncology...
In the lungs, and then exhale it from the lungs, okay?
Yeah, I guess in oncology, you have to consider, though, too, that for most of these patients that are using it, it's because they're having such bad side effects. They already have a late-stage cancer. They're having so much pain that something like that isn't going to do more damage than their body's already dealing with.
I'm speaking about the general population, though. I mean,
right.
Is this going to create more, more cancer issues? And my understanding is that a lot of insurance companies have a sort of a no-smoke clause, and if you smoke, you pay more money for your monthly benefit or whatever. So do we have not going to get a marijuana effect here or what?
I don't know. Good question.
This is definitely a gray area.
Yeah,
definitely a gray area, and it's all going to. We'll see how it plays out.
Is.
Well, I just think it's kind of ludicrous to promote smoking of another kind of material. But
Right.
Yeah.
Now, CBD oil, is that the biggest thing right now? It's just amazing.
Yeah. I do know that with the vaping, it is a big concern in this younger population. They actually, one thing we do know is that the incidence of those young kids that vape, they're really at a much higher risk of starting to actually smoke cigarettes then, which seems so backwards to me. We've done all this promotion against them not smoking, and now here we have this vaping that's going to lead them right into it. So definitely a concern.
Do you know anything about secondhand smoke from vaping? Because they seem to produce a lot more smoke. If you see somebody vaping, there's a cloud.
Yes, and it's secondhand exposure. We know that there's toxins in that. A lot of times you'll hear people say that, oh, well, it's just a waterless vapor. It's no big deal. It's a big deal. Those toxins are in that vapor. And so, yes, if you're around that and you're exposed to it, there is a risk with that secondhand exposure.
You're sitting at a traffic light and somebody's vaping and their windows down. The big cloud comes out of the car. And I think, hey, the car's on fire.
Yes, and that innocent cloud is not innocent.
Nuts. So it does remain. All this stuff remains as a huge cancer risk. And what about the hospital's no smoking programs? Still doing that?
Yep. Yes, there's no smoking allowed on our campuses.
Yeah.
And I believe employees are not allowed to smoke, correct?
Correct.
So you can't go outside and smoke?
Nope.
You have to go off campus.
Parking lot?
Yeah.
Parking lot?
Not in the parking lot.
So you got smoking inspectors.
Yes. Yes, we do.
Well, we want to lead by example.
We do.
How are we doing?
We do.
A little bit more time.
Okay. So when it comes to avoiding alcohol, it seems that there are debates half the time on how much is too much. And we talked about that a little bit earlier. And the red wine, you can think about this on the break, okay? Is it good or is it bad? Okay. You're listening to Health Matters with the Medicine Center Pharmacy right here on News Talk 1480 WHBC.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Wendy here from Studio Arts and Glass. I'd like to invite you to our annual Garden of the Arts show, Friday and Saturday, June 14th and 15th from 9 until 8 p.m. You'll find fabulous, vibrant colored summer jewelry, horsehair pottery, and tons of hummingbird feeders. Come for the great food and La Pizzeria's famous brownies. We're on Apple Grove and 77 in North Canton. Or find us at studioartsandglass.com.
The Half Off and Hot Buy store in Louisville just got in a new load of furniture from a major department store. And also lots of new drugstore merchandise from large drug chains. Of course, all this merchandise, furniture, and more is 50% off. And as a special gift to our loyal customers, we're reducing all of our furniture an additional 50% off. That's right, 50% off and an additional 50% off. Don't miss this Memorial Day sale. You'll regret it. The Half Off and Hot Buy store in Louisville. See us on Facebook or halfoffhotbuys.com. Are you sick and tired of waiting at the big chain pharmacies for your prescription? We've all been there. You aren't feeling well, and you go to pick up your prescription, and you're told to come back later. At the Medicine Center Pharmacy, you don't have to wait. We can fill your prescription in 15 minutes or less, and we could even save you some money on your prescriptions. Talk to your Medicine Center pharmacist at any one of our locations in Canton, Louisville, Minerva, and New Philadelphia. Visit medshoprx.com for more information. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Nancy and I are discussing cancer prevention with cancer nurse navigators Bobbi Freeman and Jaymi Doerfler. We've got a lot more to cover this morning, so let's get back to the show.
Okay, so we can't drink our way to better health, right? Can we eat our way to better health?
Hey, we didn't finish the subject about red wine.
Yeah, everybody wants to know.
Yeah.
So for red wine, I do want to say everything again in moderation. You know, red wine is good, but not...
What's the issue with it? There's some kind of enzyme in it or something?
And it's more for heart.
Exactly.
Like heart is they say there's benefit. Again, it has to be in moderation. And I think, don't quote me, but it's at a certain age. Like I want to say it's like once you hit 65 or something, having that daily red wine may... help decrease your heart risk.
Oh, okay.
And again,
I don't know that.
Daily, one drink a day. So for women, you're lucky.
You're not going to let this thing go, are you?
No, because you get 2 drinks. I only get 1.
Get 2.
So you can have 10 ounces of your red wine.
I don't like red wine, so it doesn't matter.
Well, you can also have a 12-ounce beer, 2 of those.
12? 2 of them guys, huh?
You are allowed because you're a man, or 1.5 ounces of liquor.
2 beers, huh? See these guys carrying out of the convenience store. They're carrying a case of beer. You know they're going to put it down in the next day or 2.
Yeah, they're not sticking with
I'm
moderation.
sure they're only going to do 1 a day.
Yeah, right.
Maybe 2.
Yikes. So when it comes to avoiding alcohol, debates all over everywhere. We've kicked this around. You folks listening to the radio program, you know now your limitations, okay? Because these ladies have told you what your limitations are, okay? So stick to that, okay?
Yes.
Yeah. Okay, so Nancy, you asked about eating. What can we do to eat? So there's definitely habits that we can develop to help decrease our risk of cancer when it comes to our diet. The American Cancer Society gives recommendations eating a healthy diet, and especially an emphasis on plant-based foods. Choosing foods and drinks in amounts that help you maintain a healthy weight. Amounts, calories, that's all different for everyone. The most important thing there is to keep that healthy weight. Limit how much processed meat and red meat that we eat. Eat at least 2.5 cups of vegetables and fruits each day, and choose whole grains instead of refined grain products. And, I think sometimes it's easier to focus on what can we eat than all the stuff we can't.
Right.
Because really, until you make those goals and try and get in that many fruits and vegetables and things, you're kind of out of meals for the day. So sometimes that can make a difference too. Of put, okay, each meal, what can I put in it that's good?
For the longest period of time, there's been discussion about charcoal cooked foods. Okay, because the charcoal is carcinogenic. I haven't heard much discussion about it lately. We cleaned up the charcoal, or what's going on here?
I don't know, honestly, Paul. I'm not. Yeah, I haven't seen any research out there in it either, so I'm not sure.
I mean, we've mostly gone to gas grills and propane or natural gas or whatever, and the charcoal seems to be an inconvenience. But the camping people, that's what they're doing, the charcoal mostly. So, but that was a big thing years ago. Was everybody was charcoal cooking, because the gas grills weren't really out yet. But I haven't heard any discussion about that lately.
Yeah, and I would guess you're perfectly right that because it's decreased, we're not hearing about it. Because, it's not even something that I see really literature in that out there about anymore. So I'm guessing it's not as much concern.
It doesn't sell like it used to in our store and things like that. But you see it piled up everywhere in all the discount stores. So they must be selling it, and then people must be using it to campers and stuff like that.
So all of us know someone that we envy for their effort to be healthy and live a healthy lifestyle. They eat well, they exercise appropriately. Should they still be concerned about their cancer risk? Should they still be participating in annual screenings?
Oh, absolutely. Participating in your screening, you definitely, you want to have that conversation with your doctor. Like I said, you want to have those well visits so they can, help you know when your screenings, and that's something that cancer navigators do too. We would love to help any patients that need any assistance in trying to, find out where can I go for these screenings and things like that.
How about cancer vaccines?
So for vaccines, we have 2 that are currently on the market now. The first one is the HPV vaccine. And I know that a lot of people have heard, about the HPV vaccine. So the actual HPV virus has been linked to cervical cancer mostly, anal cancer, penile cancer, mouth and throat cancer. Right now, it is recommended for boys and girls 11 to 12 years old. Now, anyone can get it up to the age of 26. Really, it's meant before you're sexually active. But the thing I want to point out, though, the longer that you wait, so the older that you are, the less effective it is for lowering your cancer risk. So it's a 2-dose series, usually given about 6 to 12 months apart. But over the age of 15, it turns into a 3-dose series. So I think that's really important. We've given 270 million doses so far since 2006. Wow. So the other one is the hepatitis B vaccine, and that one helps to prevent liver cancer. So currently we are giving it to our infants and adolescents. But I think that you should have that conversation with your doctor as an adult if you're at risk for contracting hepatitis B, so any blood or body fluid exchange. And it's a series of 3 doses. So those are 2 vaccines that we know can really help decrease your risk of getting cancer.
Wow.
Guess I hadn't given the hepatitis B a lot of thought.
Yeah. A lot of people don't. As healthcare professionals, we definitely do because we are high risk, for hepatitis B.
Sure. What about hep C? Is that any cancer-related data?
As far as, there's no virus, no vaccine for that, but it does, it can cause liver cancer.
Okay, so we're drinking our alcohol in moderation. We're not smoking.
Not drinking at all, from what these guys are saying.
And
we're getting 2 drinks a day.
They want you to stop complaining.
Yeah, we get one.
We only get one.
You understand I don't really drink anymore. So
well, that's good.
You're just complaining you complain.
What about exercise? How important of a strategy is that in cancer prevention?
So exercise is huge. We know that we need to really stay active. And the reason is because we have so many studies shown that obesity is really linked to a lot of cancers, including breast, colon, esophagus, gallbladder, kidney. So really staying active, maintaining our ideal weight really helps decrease those risks. And another important thing is even cancer patients that stay active and exercise throughout their treatment, they actually tolerate their treatment better, and there's better outcomes. So both ends, it's good to exercise.
Helps manage the stress, too, during
Oh, absolutely.
Yeah. Does Mercy host any exercise programs?
We do. We're actually very excited about our exercise programs. We have something for everyone. For the community, you could go to the North Canton Stat Care. There's a pool. There's a lot of, I know that there's a nurse that actually will tailor they're there 24, they're on site. They will tailor your exercise program to what you can and can't do. They have yoga. We also have a Cancer Well Fit for cancer patients, and they meet them at their needs, what they can do. So you definitely can also contact the navigators, whether you just want to stay healthy, or if you are a cancer patient and want to, work out while you're, getting your treatment. We would definitely, recommend different programs for you.
How many navigators are there at Mercy?
Well, there are a total of 6. Yes. So we have site-specific, and then we have general navigators. So we have a breast, colon, lung, and GYN.
Wow. That is very exciting.
It is.
You're probably not really schooled on what it costs to belong to that North Canton Center. Insurance covers some of that, do they not?
I can't speak to that because I don't know, but I promise that if you call me, I will get all of that information and I will look that up for you. Okay. But I know it is, they do try to make it affordable because our goal is to get more people from the community in.
Sure. Very interesting. Both those places up there are busier than a heck all day long.
They are. They are. But I know their pool, they told me the pool is warm.
Yes, how warm is warm? Can't be cold. Not at 8 o'clock in the morning or whatever.
Exactly.
So, okay. What about early detection cancer?
So we, we're big advocates for early detection, obviously. I'm going to speak to some of them. I'm the GYN navigator, so cervical cancer is always on my radar. So women should always, start their pap smears at the age of 21. You should get your pap smear, women between the ages of 21 to 29, every 3 years. And then women over the age of 30, every 5 years with HPV testing also. We know that cervical cancer is the most common cause of cancer that kills, females. So it's really important to get those pap smears. Breast is another one. Women should start getting their mammograms at 40. Between the ages of 40 to 54, they should get an annual mammogram, so every year. And then after 55 or older, they should get a mammogram every 2 years. The American Cancer Society says that the screening should continue as long as women are expected to live 10 years or greater. So that's, again, having that conversation with your doctor, when should I stop having my mammograms or should I continue? The last one that I want to talk about is colon cancer. And the American Cancer Society recommends that you should start stool-based tests and colonoscopies at the age of 45. So if you're in good health, you should continue regular screenings through the age of 75. After 75, really, again, talking with your physician, looking at your history, your risks, and then they really say after 85, you no longer need to be screened.
Okay. Got to take a break. He's pushing me hard here.
Oh, sorry.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Have you heard about Tap On It? It's a new way to get great coupons on your smartphone from all types of vendors. Hi, Paul White for the Medicine Center Pharmacies. So you text the words Tap On It, that's Tap On It, TAPONIT, 82928. Tap on the link that comes up, and up comes your coupons. The Medicine Center Pharmacy coupons are buy $30 worth of merchandise at the Medicine Center Pharmacy and get $10 off. You can also earn a free first aid kit. This is a great way to save money. Tap on it at the Medicine Center Pharmacy. The Half Off and Out By store in Louisville just got in a new load of furniture from a major department store, and also lots of new drugstore merchandise from large drug chains. Of course, all this merchandise, furniture, and more is 50% off. And as a special gift to our loyal customers, we're reducing all of our furniture an additional 50% off. That's right, 50% off and an additional 50% off. Don't miss this Memorial Day sale. You'll regret it. The Half Off and Out By store in Louisville. See us on Facebook or halfoffhotbuys.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. And thanks for joining us this morning. So, where are we at, Nancy?
Well, we're talking about healthy habits.
Yes, we broke into your discussion.
Yes, so I was going to tell you about what we have for lung cancer. So we do actually have a lung cancer screening tool that just came on the scene about 5 years ago. It's like a chest CT. We call it a low-dose CT screening because it's a much lower exposure of radiation than a regular chest CT. Insurances are covering it, but you have to be high risk. So the criteria to have it covered by your insurance is 55 to 77 years old. You have to either be a current smoker or quit within the last 15 years, and you have to have a 30-pack year smoking history, which what that means is 1 pack a day for 30 years. So,
Okay.
it could be 2 pack, however it equivalates to that.
Okay.
And we've actually seen just amazing results with this test in even just the 5 years. We're catching a lot of early lung cancer because lung cancer doesn't show you any signs until it is much more progressed.
Yeah.
So we're actually catching a lot much earlier when we have a lot more options to treat you and much better outcomes. So it's really, really been a game changer on the scene for smokers or a history of smoking. We also, just to touch on prostate cancer, it's definitely one that American Cancer Society is still recommending that at age 50 you start having a conversation. And it is not necessarily for everyone. So their recommendation is that you definitely discuss the risks and benefits with your primary care or your healthcare provider. Now, if you are African American or you have a father or a brother who had prostate cancer before the age of 65, they recommend that conversation starts at 45. So 5 years earlier if you're a little more in that high-risk category.
Not exactly sure. We've covered this before. You are okay. Go ahead.
Yeah. So for those of you listening, I hope you'll get to see on Facebook because both Bobbi and Jaymi exude empathy, compassion, and excitement for what they do and the role that they play. Could you take a moment and talk about what you do and what a nurse navigator does?
So for me, we love our job. and we have a great team, but we love our job because we love our patients. This job is easy because of our patients. But my primary goal as a navigator really is to remove barriers for the patient, whether that's financial, whether that's transportation, really anything. So they can focus on getting what's important, and that's their treatment, getting through their treatment, getting the care that they need. So that's why my job is really the best job.
Yeah, and I couldn't say it better. I mean, that's absolutely why we do what we do, is just helping the patients at such a time. And, that's why we have specific navigators for everything. My role is a general navigator. What that means is all those other ones that we don't have a specific. We have specific lung, breast, colon, GYN, but there's a lot of other cancers out there. So your prostate, your melanoma, your lymphoma, leukemia doesn't want to come out. Whatever it might be, I see all of those patients because one of the biggest goals, I think, for Mercy Cancer Center is that we don't want anyone to have to walk this journey alone. So we, every cancer patient that's coming through our doors, we want to make sure that they have someone walking this with them. And that's why we have kind of all the different navigators.
Yeah, it's interesting that your attitudes are this way because you see a lot of people die.
We do. But we get much more benefit. We get to help these people at the lowest point of their life. We also get to experience their highs, and it's amazing.
Yeah. It is.
That would be, to me, that would be the distressing part of your job. So and
I guess there's something about us that, people that don't like death don't really go into oncology. And it's not that we like it, but, these people are going to face it regardless. And if we can be there to make that end, because at that point, there's no changing it. There's nothing they can do. Simply by helping a patient facing the end of their life, make that look like they want it to. Hope can come in many different ways. So, how do you want this to look? Do you want to be in the hospital? Do you want to be at home? Do you want your loved ones around? That can look so different for everyone. And being able to support them in that and make it happen however they want gives them some of that control back.
I can remember speaking to a hospice group quite a few years ago, and there were a lot of people in the room. And, of course, going into the room, these people are going to die, and some soon, and some maybe not so soon. I stayed around after the meeting, talked to a few of them, that sort of thing, and it was interesting. I thought it was very interesting how upbeat most of them were. Okay, one or two just wasn't. But I guess I was able to communicate with them, and me being a healthy person, and I thought, gosh, what happens when you face this? So what about hospice for your part?
I do want to say this. Right now, there is a light to cancer also. I mean, we have more patients living with cancer. There's 15.5 million Americans right now that has lived with cancer and beyond. Our survivorship program is very strong, and we are excited about that because it's only growing. So it isn't always doom and gloom in oncology. We get to celebrate survivorship. And so there is hope. It's not always about hospice. Hospice has a wonderful place in oncology, and we're glad that they're there, and we're very we collaborate well with them.
Do you think America is the leader in cancer survival rates compared to? I don't even know what's going on around the world.
I think that we, as far as our technologies are just improving. I mean, it just shows that, cancer survivors are living longer. So we're definitely improving in all of our treatment modalities. So I think that's exciting. And I think we are, definitely, we're only getting better.
Are insurance companies generally an obstacle, or are they? Do they open the door for this?
That's a whole different topic.
But you guys know about this. I know that.
Right. That's also where we come into play because every insurance is different. Some are going to cover things very well, some are not. But there's so many good foundations and organizations out there too. That, even if, say, they have high copays that they can't afford, there's a program out there that's going to help with those copays. So that's a lot of what we do, too, is those patients that are having issues financially, whatever it might be, is finding them the right resources and tapping them into those. Because, that's always, finances are a big, huge concern for patients, and mostly because of their loved ones and, what that's going to do to their family and things. And so when we can find them help with that, that is a huge burden that we can take off their shoulders.
What about Medicare and cancer care and stuff like that?
What about
you look strange. You're not.
I mean, they cover.
Are they cooperative?
Care.
I guess is where I'm coming from.
They cover cancer care just like they cover everything else.
Okay.
That 80-20 usually, and there's no difference.
Okay.
I think their system's pretty laid out.
And we still have the same, things that we have to deal with.
Right.
We have to find patients, even in Medicare, different. Nobody wants. Cancer can break a family,
Sure.
So we kind of come in and really help them find different resources to prevent that from happening, or at least help them, find a way to.
So we have about 2 minutes left, and maybe you could tell us some things about where you are and your phone numbers and how we could converse with you, things along that line.
Sure. So our website, Mercy's website, is cantonmercy.org. My direct line is 330-430-2777.
And mine is 330-588-4588.
And we welcome any calls, any information. I tell even my patients, when you don't know who to call me. And if I don't have the answer, I will hunt you the person who does. So it's not 10 calls for them. So
compared to the way things used to be, where you had to go through the switchboard. Well, I can't find that person today.
Right. Nope. Those are our direct lines.
Call back next month.
Nope.
I may not be here next month.
What's the most important thing you want our listeners to walk away from this show with today?
I think for me that is simply knowing that we are here. Many people don't know navigators exist. But when you're faced with that cancer diagnosis, we can really make a huge difference. It's like a bomb went off in their life, and we can come in there and kind of slowly help you put those pieces back by just listening, offering support. We can tap into so many other specialties, dietary, PT, whatever it is that you need. We're kind of that one person who can really follow you through the whole process and bring alongside you whatever you need, so that you have what you need to walk this process.
We're out of here. Okay.
All right.
Thank you to our guests, Bobbi Freeman, Cancer Nurse Navigator, and Jaymi Doerfler, GYN Nurse Cancer Nurse Navigator. Please contact your healthcare provider if you need help. Don't delay that. Thanks to Mercy Medical Center, Studio Arts and Glass, and always thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com.